The nephrology program at Children's Hospital is a collaboration between two of the most esteemed academic institutions in the city. The LSU School of Medicine, represented by the Department of Pediatrics, and the Tulane School of Medicine, represented by the Department of Surgery. All working together and collaborating to provide the best specialty care in nephrology in the only freestanding and fully featured children's hospital in the state. We are passionate about helping children with kidney disease reach their full potential.
About 25 years ago, I and two other nephrologists, pediatric nephrologists, were brought here to really establish a all-service academic pediatric nephrology center. I'm very grateful to Children's Hospital, who was very accommodating. Even when I said, first couple of years, this effort is going to be losing money, and the CEO say, that's okay, as long as we provide excellent care for children. Children's Hospital has been very supportive.
Our hospital provides services that are not offered in any other institution in the state of Louisiana. We have trained professionals that are really competent in the field of pediatric nephrology, and we provide all the services, including dialysis, kidney transplantation, and apheresis in a single institution.
It's nice to have all the latest tools at our disposal so that they can be offered the best care possible. In some surgical instances, the best care can be rendered in a minimally invasive fashion, and we're fortunate here at Children's to have a full armamentarium of minimally invasive technology that could range from scopes allowing us to do endourology procedures or taking care of urologic needs without having to make an incision at all. If an incision is needed, we can then use laparoscopy or robotic surgery to minimize the actual incision length that would be needed to access the site of surgery.
The big problem was that the city was basically closed for 7 weeks because of the water and flooding. So Children's Hospital immediately bought a clinic building in 75 miles away in Baton Rouge. I and other physicians started working there, seeing patients. I put an email message to all pediatric nephrologists in the country saying, please contact if my patients show up, because we had not prepared patients, with medical records and so on. Nowadays, we're much better prepared.
I think one of the amazing things about this program is that it truly brings together all of the major academic centers in the city so that we can put the best heads together to have the best outcomes for our kids. So that's Tulane, LSU, Children's working together for this pediatric program at Children's Hospital.
As far as children with kidney disease, they're not small adults. So it takes a group of highly specialized people and a lot of teamwork to deliver the best and most comprehensive care to these children. That would include pediatric nephrologists, surgeons, urologists, nurses, transplant coordinators, social workers, and dietitians. And that's exactly what we do here every day at Children's.
When it comes to care of renal diseases in children, there's often a lot of overlap between the services that a nephrology provider would bring to the table and what the urology provider would bring to the table. And so just by the nature of it, it's kind of meant for collaboration. For instance, there's a lot of congenital urologic diseases that, if not managed ideally, can lead to later renal dysfunction.
Cody was born with kidney disease, so when about 2 years ago, they told us that he was going to have to start dialysis, and this was the first hospital that was recommended to us by several people that we know. The training, whenever we do the dialysis training, they have the best people working here, and I wouldn't go anywhere else.
Like 10 years ago, I went to use the restroom, and it was painful for me to urinate, so I was referred to a specialist here, and it turns out that I had FSGS, which is a disease that causes your kidney to lose a lot of protein, and as a result, I had kidney failure. They're great. I consider them like my second family. This is like my second home. I am very open with them. I can talk to them really about anything. They've established a really great relationship with me over the years, and yeah, they're really open and welcoming people, and I am grateful to have them in my life.
It's the environment where every employee in the institution wants to give the best possible effort to provide the optimal care for our patients, and that really encourages us to deliver the care that every patient deserves.
I think the future for Children's is very bright. We've invested more than $300 million in a state-of-the-art campus transformation. We're recruiting the best talents from around the country. We're collaborating with both local and national organizations in ways that we haven't done before. It's all very exciting, and it's a great time to be here in New Orleans.